Do you find yourself with either unexplained trap upper shoulder problems, pain along the abdomen into the side of the ribs, or maybe even more anxiety than you think you should have? Well, it could come down to proper breathing mechanics, and a discussion I'd like to have on belly breathing today. Hi, my name is Dr. Connor Davis here with Transcend Chiropractic, and we're going to talk about something that I'm pretty passionate about, and that is proper breathing mechanics. Now, if you notice yourself doing a lot of this heaving kind of breaths from your chest, it's not that that can't ever happen, but it's not how every breath should happen. And that's going to, one, wear out your diaphragm because it doesn't like that, and two, it's going to use a bunch of accessory muscles from the shoulders, and over time that could cause some discomfort in that region. Or if you're talking from a sympathetic parasympathetic way, this panting kind of chest heaving breath is going to engage the sympathetic nervous system, could lead to some more anxiety. So today we're going to go through belly breathing and how a person should take every breath. So ideally, if you look at me here from the side, you'll notice when I take a breath, when I breathe in, my belly goes out. When I breathe out, my belly goes in. That's how every breath should be taken. Now, if you find yourself doing the opposite of that, where every time you take a breath in, your chest comes up really big and your stomach is doing the opposite of that, that can lead to some problems. So how do you fix this? I've found the best way to do that, thinking from the side again, is even if this doesn't feel natural, when you go to take a breath out, I want you to almost collapse your stomach in and suck it in almost as hard as you can. Example. And then when you take a breath in, your stomach almost has to rebound out. Now, it's not so much about the stomach, it's actually what the diaphragm is doing. I'm just using the stomach as a way to help get the diaphragm working. Essentially, when you take a deep breath in and your abdomen, your stomach goes out, that's the diaphragm expanding. When it comes in, that's it contracting, and that's what really should be pumping the lungs. So from the side, just one more time, if you want to follow along with me, you're going to try to breathe out with the stomach almost sucking in as hard as you can. And then that rebound breath is going to allow the abdomen, the diaphragm, to expand. Now, this is something that might take a lot of work. It might feel really unnatural, but trust me, getting this breathing rewrited in your body is going to have some big impacts, not just on your parasympathetic nervous system, but also on just how the musculature, abdomen, diaphragm, and shoulders feel. If you found this video helpful, go ahead, like, follow, subscribe to our YouTube page. There's a lot of great information there. Once again, Dr. Connor Davis here with Transcend Chiropractic.